Welcome to Specialized Techniques, Risk Communication for Vulnerable Populations. Risk communication is a critical component of pharmacovigilance, especially when addressing vulnerable populations. These groups, which include children, the elderly, individuals with disabilities, and those from marginalized communities, often face unique barriers to understanding and acting upon health-related risks. Effective communication can help reduce these barriers, ensuring that vulnerable populations are informed, empowered, and protected. However, achieving this requires a nuanced approach that accounts for social, cultural, and linguistic diversity, as well as differing levels of health literacy. Identifying vulnerable populations. Vulnerable populations, by definition, are groups that may have limited access to health resources or at a greater risk for adverse health outcomes due to economic, social, or biological factors. Examples: pediatric populations require simplified communications, non-native speakers or those with limited language proficiency, patients from low-income backgrounds with limited healthcare access. Significance in risk communication: ensuring inclusivity in messaging to prevent adverse drug reactions and promote medication adherence. Cultural sensitivity in risk communication. Challenges: different cultural norms and beliefs about health can lead to mistrust or misinterpretation of communication efforts. Solutions: collaborating with community leaders to co-develop communication materials using culturally appropriate visual aids and examples. Example: tailoring vaccination risk communication campaigns to address vaccine hesitancy in specific communities. Health literacy and education. Low health literacy. Many vulnerable populations may struggle to understand medical terms or complex risk information. How to improve health literacy in vulnerable populations: using plain language, providing multilingual resources, leverage storytelling, and creating visual guides. Using plain non-technical language is a good approach, leveraging storytelling or analogies to explain complicated and complex risks, providing bilingual or multilingual resources when necessary. For example, creating medication guides with visual instructions for individuals with limited literacy. Channels of communications. Preferred channels for vulnerable groups. Community organizations, clinics, or trusted local networks for dissemination. Communication channels and barriers for vulnerable groups. Face-to-face healthcare interactions build trust through personal connections in low-tech areas, broadcast media in remote areas, social media engagement, and mobile apps with distrust. Social media and mobile apps are for tech-savvy populations. Broadcast media: example, radio in remote areas with limited internet access. Barriers: lack of access to certain technologies or lack of trust in official sources. Warm touch: face-to-face communication with healthcare workers often build more trust than mass communications. Ethical considerations. Key issues in ethics: ensuring respect for autonomy and informed consent, avoiding fear-inducing or alarmist language, providing consistent and unbiased information. Examples of best practices would be pharmacovigilance campaigns for vulnerable children always involve parental consent and clear, jargon-free communication. Feedback mechanisms. Importance of feedback: encouraging interactive communications to confirm understanding. Methods: surveys, follow-up calls, or real-time feedback discussions during focus groups. Outcome: continuing improvement in communication strategies based on end user feedback.